When Eric Brodell arrived at Indiana University for his freshman year, a new sport caught his eye.
I was here for summer orientation back in June of 2010, and I walked in the bakehouse with my mother, and I saw a Cutters jersey hanging on the wall and had heard that the Cutters were a prestigious cycling team here in Bloomington, so I wanted to get to know a little bit more about them.
Lucky for Eric, a number of Cutters cyclists were at the bakehouse that day. As Eric began classes, he also began riding with the Cutters. On a wet and rainy October 13, 2010, 4 members of the team gathered for a typical practice ride.
That day it was just more of a training ride to get base miles in. It was just a normal ride, nothing special about it.
The team headed east to State Road 446, an area they ride in quite often.
We had passed multiple cars going the other way. It wasn't a concern at all because we had gone around turns. 446 is a curvy road.
As the team came around the next curve, however, Eric noticed a car going too fast for the wet, slick conditions.
Well, once I saw the car, I knew that this guy was going too fast, and he was gonna slide into us. And once he saw us, he slammed on his brakes and kind of slid straight forward instead of going around the turn.
The car hit 3 of the 4 riders. Eric was the first to collide with the car and took the brunt of the hit.
I got hit by the car, flew through the air. Remember, I was all spread out and couldn't bring my limbs in. Once I hit the ground, it was kind of like a little bit of a shell shock. I couldn't really hear. I was seeing blue stars, and I was awake the whole time. And then I tried to get up and couldn't. I looked down at my leg and it was completely open. When I looked at my leg, I said, "Oh man, I'm actually gonna die." Like, I thought I was gonna bleed to death. But it was really a terrifying experience.
Fortunately for Eric and his teammates, an emergency department nurse was driving in the car behind them.
She jumped out of her car, ran over to me, said, "Hey, I'm an ED nurse." She put her gloves on, started to try and stop the bleeding. I don't know her name, but she knows what she did, and I hope that she knows that she saved my life.
Emergency crews arrived and took him to IU Health Bloomington Hospital. A trauma team was already in place, including IU Health Southern Indiana Physicians Orthopedic and Sports Medicine Surgeon, Dr. Timothy Steiner.
I knew and had heard from down in the OR what was going on, that 4 cyclists had been hit by a car. And as a cyclist myself, it was kind of scary. I know what a car can do to a person, and it's not pretty usually. And you hear that 4 students are hit by a car and you get pretty worried.
After first making sure Eric was okay, Dr. Steiner examined his leg and found that his thigh muscle was almost completely lacerated.
That's a pretty extensive injury for someone who's athletic and that wants to get back to playing sports.
Steiner told me that I was going to be okay and that he was going to be able to fix me up just fine.
After 2 surgeries to clean out Eric's wound and prevent infection, Dr. Steiner performed reconstructive surgery to repair Eric's torn muscle.
The biggest problem with this is he's a cyclist, and the most important muscle in the leg for a cyclist is the quad, and he had lacerated the quad nearly in half all the way across above the top of his knee. So we really wanted to get that musculotendinous unit back together.
With surgery behind him, it was up to Eric to work through the rehabilitation and recovery process.
Dr. Steiner told me that there wasn't really a playbook on the recovery for an MCL injury and trauma like I had. The whole recovery process was a little bit rough. That was the hardest part.
I always tell my patients it's a 50-50 deal. My 50% is fixing you and 50% is rehab. You've got to do your own work, and he did a phenomenal job.
I didn't want to do anything else but ride my bike at that time, which sounds funny, but I just couldn't wait to get back and start riding again. And Orthopedics of Southern Indiana, IU Health, really just helped me a lot.
Just a little over 2 months after his accident, Eric was back on his bike.
I had just gotten a new bike and it was snowing. I rode about 10 or 15 miles and had my parents come pick me up because I was so tired and my leg hurt. But it was really nice to be able to get back out on my bike.
He did everything we asked of him and more, and he got back to riding and he got back to racing, and every once in a while I see him on the street riding around.
Today, Eric continues to race and train with the Cutters, with hopes of riding on the race day team in the next Little 500 at IU.
This next year, in my senior year, I'm really hoping to be on the race day team. I just wanted to make sure that everybody at the hospital that took care of me, and even outside of the hospital, and the whole IU Health system, that I appreciate all that they did for me and all their tremendous work. They really put me back into my life quickly. I didn't expect that to happen, so I'm very grateful for everybody that helped me out.